Hello everyone, welcome back to my channel. How are you doing? It's your favorite nurse Meifa here again, and today we'll be talking about how to care for your newborn. Remember the last time we talked about how to achieve pregnancy faster. Today we'll be talking about how to care for your newborn. We're giving you guides on how you can appropriately care for your newborn. So without wasting any much time, let's start. So number one, warmth. It is very, very important. As soon as baby comes out, you want to put baby to the mother's skin. You want to give warmth and cover with a blanket. That is very, very essential to help the baby in the transition of extrauterine life. You know, baby, where baby is coming from is very warm and cozy always. But baby is coming out to the outside world. You want to maintain baby's temperature to ensure you keep baby warm. So after baby has been cleaned and properly dressed, you would wrap baby appropriately. And in dressing the baby, it's preferable to layer baby in 3 layers. First of all, the singlet inside, maybe rompers or whatever you call it, we call it penny inside, then a two-piece up and down, preferably two-piece, so that you can put an eye on the umbilical cord. Because if you cover it completely, you might not know if the umbilical cord is seeping blood or what have you. So ensure you put baby on 3 layers. Then the first layer is the inner one, the second one is the two-piece, then the third layer is the wrapper, the swaddle that used to swaddle baby. Wrap baby warmly and keep baby on his back. Lie baby down facing. We'll talk more about how to lie baby down. So you lie baby down properly and ensure that the room is warm. You don't want the room to be too hot because babies can get overheated so fast. Since you have dressed baby properly and you have wrapped baby, the room should be warm and well ventilated. Please and please ensure that the room is warm and well ventilated. Then don't put baby on cold surfaces like all those trays that they used to clean babies and things like that in the hospitals and even at home where they used to dress baby or change baby's diaper and things like that. Ensure that you keep baby always in a place that is warm and good for the baby. So we have talked about warmth. Now we'll go to the second guide, which is feeding. Feeding is very, very important. Immediately baby comes out, most times babies are hungry because the mother has been laboring. If you are going through normal labor or if you want to do CS, after before cesarean section, you have to stay away from food for some time. So baby is hungry. As soon as baby comes out, if there are no other conditions, if there are no underlying factors why baby should not eat, please feed baby immediately. We always advocate for breastfeeding. Breastfeeding for the first 6 months of life. Please put baby to breast immediately. Let the baby latch and suck on the breast properly to help them, baby and mother, to bond and also create warmth. Ensure you observe baby as baby is sucking. If baby is sucking properly, if the baby is swallowing properly, or if there are any issues, please take note and call on the attention of your health professional immediately. Then, if the mother for any reason cannot breastfeed, formula feed is advised. Formula food should be given to the baby immediately. That is baby food. Give baby food to the baby. There are proper ways on making baby food. Don't just use eye gauge. Oh, put some more milk. Make it thick so that the baby, no, you will constipate the baby, you will give the baby problems. The formula is 30 mils of clean, warm, drinkable water to 1 level spoon of the feed. Look at the container of the baby food. You see the instructions on how to reconstitute the baby food, how to mix the baby food for the baby. Please follow the instruction. Do not allow one auntie that is an expert in her own way to come and tell you, no, put the thing, let it be thick. It's too thick. It's a baby that is just coming out. It's too thick. And make it put more water. You would just do harm to that baby. It's either you are not feeding properly, you are underfeeding, or the issues are just too much around us. So be sure you do what is instructed. And there are baby foods, formula feeds that are very good, that are almost like breast milk. If you want, I can recommend to you. Let me know in the comment section. Or if you are a mom here and you have good formula feeds that you can swear by, please let us know. Let others learn also from you. So the feeding is very important. Then after feeding, either by formula or breastfeeding, ensure that you burp baby. Let the baby beige, because you don't want stories that touch. You do not want stories that touch, oh my sister. Let that baby beige. Burp that baby. Put the baby on your shoulder. Wait and listen. Ensure you rub the baby's back and you listen carefully. If the baby does not belch at all, it should belch at least 2 times. Baby should belch up to 6 times. But if at all you are impatient, or the baby is not belching fast, or the baby is not fed to satisfaction, at least baby should belch at least 2 times to avoid regurgitation. Which, if baby is not properly laid and the baby regurgitates, baby can get aspirated, and that can end. Like, we'll talk more on that as we go along the video. So please take note of that. Then monitor the baby as you are feeding the baby. Be monitoring the baby, how the baby is sucking. Is the baby sucking properly? Is the baby swallowing properly? Or as the food is entering the mouth, it's pouring out from one side? If any concern arises, please call on the attention of a licensed healthcare professional. Call your healthcare professional immediately. So we move on to number 3. Number 3 guide is hygiene. Hygiene and health. Please, hand washing is very important. Wash your hands with soap and water before and after handling the baby. Please and please. Then care of the cord. The umbilical cord should be cared for properly. Please, it should not be done by everybody, all and sundry that comes visiting, mother-in-law, friend, relative. No, only one person, whoever is cleaning the cord, should be the only person cleaning the cord. And we have different school of thought all over. Some persons will say clean with spirit. Some school of thought will say clean with spirit swab, spirit and cotton wool. If you are using spirit and cotton wool, we do it every 2 hours. Every 2 hours you clean the cord. Then if you are using chlorhexidine gel, as some school of thought will say, when you apply the chlorhexidine, leave it. Please do not put ointment or powder on the umbilical cord. Also, keep the umbilical cord out of the diaper. Don't put it inside the diaper, because it can get contaminated and infection can climb into the baby from feces or urine, fecal matter. As the baby poops, poop can rub on the umbilical cord if it's inside the diaper, or urine can rub on it if it's inside there, or heat, it can get moistened and start rotting if it's inside the diaper. So please ensure you put it out of the diaper, and make sure those sharp edges of the diaper are far from the cord. Belt it down and put it on the soft surface of the diaper. You get that? Good. Make sure you do that by yourself. Then there's a pattern for cleaning the cord. You get 5 big chunks of cotton wool soaked with spirits if you are using cotton wool and spirit method. For example, this is the umbilical cord. You use your eyes to divide it to 4 parts. For example, 1, 2, and the side. Front is 1, back is 2, the sides are 3 and 4. Then you have the stump. So you take one big chunk of the cotton wool that has been soaked in spirit. You wipe and you wipe. You don't wipe from top to bottom. Like, you wipe from the base to the apex. You wipe from the base to the apex. You wipe, you discard. You pick the second one. You come to this side. You clean. You turn it to the other side. You clean. You discard. You pick the third one. You clean and turn it and clean, discard. The fourth one, the same thing on this side, clean and clean. The fifth one, use it to squeeze the stump and you discard. Then you put the cord on top the diaper and leave it like that. Wrap the baby and do that every 2 hours if you are using spirit as well. If you are using chlorhexidine, just apply the chlorhexidine after bathing the baby in the morning. And when bathing baby, we always advise for the first 24 hours of life, please leave the baby to adjust to the outside world. Please leave baby for the first 24 hours. And when you want to bathe baby, please ensure that the water is not too hot, and it's not, don't use cold water to bathe baby, please. And don't use hot water to bathe. If you don't have a bath thermometer, there's a bath thermometer that is used to check the temperature of the water. But if you don't have, you can use your elbow. Ensure your hand is clean. Not after you have rubbed your hand on a dirty surface. Please ensure the hand of whoever is bathing baby is clean. If possible, wash your hands up to your elbows before preparing baby's water. Then you use your hand to check the temperature of the water and make sure it is not too hot and not too cold. Then you can use it to bathe baby. We'll do a detailed video. I will do a detailed video and explain how to bathe a newborn, so that you don't go and be bathing the newborn as if you are bathing an adult. So that is for that. Then when feeding the baby, as you are breastfeeding or bottle feeding, monitor the way the baby is sucking and swallowing. And if the baby is not sucking properly or swallowing properly, please draw the attention of your healthcare provider. Then you are washing your hands. I've talked about washing your hands. Then changing of the diaper is very important. Change it frequently, if possible, every 4 hours. Whether baby has urinated just once or has pooped or not. Once the baby poop, please remove the diaper. Then if it's just urine, 4 hours, please remove the diaper. And when you are using the wipe, you wipe like this, not like this, so that you don't introduce fecal matter into the vagina of the baby if it's a female baby or otherwise. Then for the wipe, please use soft water-based wipe, non-scented to avoid allergic reactions. Then after wiping, to change the diaper, to put a new diaper, you use petroleum jelly to rub on the groins and also the buttocks of the baby to protect it from rashes and excoriation from diaper, and also allergy from some kind of diapers. If you want to know the best products of petroleum jelly that we recommend, let me know. We have lots of them out there in the market, but there are some that we swear by. Please let me know. And also, the kind of diaper you use is very important. Let me know if you want recommendations on good diaper that are non-allergic that babies can use. Then also, if you are a mother, first time, second time, or third time, or whatever time mother, let us know diapers that you use that were very good, that did not give your baby rash and all of that. So talking about the health, I've talked about hygiene now. Let's talk about the health of the baby. Please and please, if you observe that your baby is getting fair, your baby is getting one kind of yellowish color, it is not freshness. So it could be jaundice. So please watch out for skin color discoloration or discoloration of the conjunctiva. Conjunctiva is this white part of the eye. Look at the baby's eye. Is it turning yellow? Is it greenish kind of? Please call your healthcare professional immediately. We have physiological and pathological jaundice. Physiological jaundice can be normal to an extent, but pathological jaundice, you don't want a baby that will be keneteric later and you have issues. So please inform your healthcare professional immediately. Then also watch out for infections. Like I said, if the cord is not properly cared for, infections can accelerate to the baby. Please watch out for infection. How do you know infection? You see that baby is having fever, running temperature, baby is lethargic, weak, refusing food and all of that. Please ensure you call the attention of your healthcare professional. Also, you monitor the breathing of the baby. Normally babies' breaths are faster than adults' breath, but there is a normal range. Some texts will say 30 to 60, other texts will say 40 to 60 beats per minute, counts per minute. You just, as the baby is breathing, you see the rise and fall. Babies, as a newborn, they breathe abdominally. So you look at the abdomen and you time yourself for 1 minute and count. If the breathing is too fast, if the breathing is shallow, or if you are hearing wheezy noises or crackles or crepitations or any kind of abnormal sound, call your healthcare professional immediately. Or if you notice nasal flaring, that the baby's nose, see what is happening now. Take a look at my nose. Baby is breathing and you are seeing something like this. Please call your healthcare professional immediately. Or you can see the rib cage going in and out as baby is breathing. Please call your healthcare professional. Or you see this middle part of the baby's epigastric region, that is this part going sunken deep as the baby is breathing. Rush that baby back to the hospital if you have been discharged, or if not, call your healthcare professional or whatever you have around you. Please, that is very, very, very important. It cannot be overemphasized. It cannot be overemphasized. You want to monitor that and ensure that the baby is fine. And when feeding, ensure that you see that the baby is breathing properly. And when you lie baby down, please avoid clothes around, bed linens around. Let's go back to what we have said. We said number 1, warmth. Number 2, feeding. Number 3, hygiene and health. Those are the 3 guides I promised. Then the 4th guide the bonus of it, please get support. Sleep, sleep, get support, and bond with your baby. Sleep when baby is sleeping. Reduce visitors, reduce calls. I know everybody is happy for you. They want to congratulate you. They want to give you message and all of that. Please ensure you sleep while baby is sleeping, because you need your mind to be sound. You need your body to be well rested so that you can take care of it. Prioritize your well-being. It cannot be overemphasized. Then while sleeping, do not sleep too close to the baby. Baby should have a cot close to your bed, and ensure you sleep in the same room with the baby at least for the first 6 months to 1 year. Make sure you sleep with the baby in the same room. The baby's cot should be close to your bed, and the cot should be well layered, properly dressed. There should be no bed linens around to avoid suffocation. And also, split baby on the back with the head turned to one side. Baby should lie on their back with the head turned to one side. Every 2 hours, turn baby's head from side to side to avoid flat head, so that the baby will not always be sleeping in one position. You see that the head is flat, though sleeping on only one side, and you see that the baby, anytime you carry baby like this, baby is always turning to one side because they're not alternating the sides as the baby is sleeping. Please make sure you turn the baby's head from side to side every 2 hours to avoid stiff neck or flat head from the baby always lying and facing up. Please ensure to turn baby's head from side to side, and get support as the mom, a new mom, a first time mom, second time, third time mom, whatever time mom that you are. Please, you are not an expert. Get support from trusted friends, trusted religious member or family member around you. If you don't have family around you, get paid support from nannies, or if you are confused about anything, get guide. Call your healthcare professional and get clarifications. Report any concern. Ask your question. Questions are not too much. Ask your question. If you have any further concerns that I did not mention, please drop in the comment section. Or if you have other tips or guides that you think others should know about, kindly let us know and share your thoughts with us in the comment section. Thank you very much for staying with me up to this time. It's your favorite nurse midwife, Meifab. Until I see you again in the next one, do take care of yourself. Take care.